Jason, I'm Jessica. I'm going to do a motor exam on you today. Can you tell me where you are?
At home.
And can you tell me about what time it is?
It's about 1 o'clock.
And can you count forward by sevens for me?
7, 14, 21, 28.
Okay, very good. The next thing I'm going to do is I'm going to inspect your skin. So I'm looking at your skin for even color. I don't see any rashes or lesions or any bruising on the front of the legs. I'm going to palpate for temperature. Hands, arms, legs. I'm going to check your skin's texture. And the legs. And I'm going to check for turgor, so I'm just going to do a little pinch on your arm and check for tinting. And on the feet. And there's no tinting, very good. Okay, the next thing I'm going to do is I'm going to inspect your hair. So I'm just looking for even distribution and color. Okay, and I'm going to inspect your nails. So I'm going to take a look. I don't see any cracks or ridges. They're nice and pink on the toes and fingers. And then I'm going to do a test for clubbing. I'm going to have you hold your fingers together like this, your 2 index fingers. Go ahead and do like this. And I can see through the index fingers, so I know you don't have any clubbing. Okay, thank you. And I'm going to check capillary refill on your fingers. Very good. And then down on your toes. Okay. Okay. Hair, skin, nails. Okay, so now I'm going to inspect your head, face, and neck. All of the facial features are symmetric. I don't see any lesions or rashes. The neck doesn't have any jugular vein distension. So now I'm going to palpate your scalp. Tell me if you feel any tenderness or pain. No pain, no tenderness?
Mm-mm.
Okay. The next thing I'm going to do is I'm going to palpate the lymph nodes. Okay, so I'm going to start from behind and do the occipital, the postauricular, preauricular. I'm going to have you tilt your head up a tiny bit. I'm going to come down the front of the jaw, do the tonsillar, submandibular, submental. I'm going to do the posterior chain, the anterior chain, and then above the clavicle. Okay. Then I'm going to palpate your sinuses. Tell me if you feel any pain.
No.
Any tenderness?
No.
Okay, I'm going to palpate the temporomandibular joint. So go ahead and open your mouth and close it. Okay, no popping, no pain there.
No.
Okay, I'm going to palpate your trachea, so look up a tiny bit. Trachea is midline. And I'm going to palpate for tracheal tug, which there is none. Okay, look straight at me. Then I'm going to have you clench your teeth. Like this. I'm just going to feel for the masseter muscle, do some of the cranial nerves. Okay. The next thing I'm going to do is have a piece of cotton. You see your hand? This is what it feels like. So I'm going to have you close your eyes, and when you feel it on your face, just tell me. Okay? So close your eyes.
Okay. I feel it. Okay.
Okay. Okay, so, oh, the next thing I'm going to do is have you smile, frown, puff out your cheeks, like that, purse your lips like you're going to whistle, and close your eyes real tight, and don't let me open them. Okay. The next thing I'm going to do is palpate the thyroid. So I'm going to give you a sip of water. So take a sip of water and don't swallow. Okay. I'm going to turn your head slightly to this side. I'm going to move your trachea over. Move my fingers in and take a swallow. Okay. Then we're going to do the same thing on the other side. Sip of water. Don't swallow. Turn your head slightly to this side. Push the trachea this time over. Bring the fingers in and swallow. Okay. Okay, now I'm going to inspect the ears. So I'm looking in front and behind. I don't see any rashes or lesions on either side. I don't see any drainage from the ears. The ears are symmetric. I'm going to palpate. Is there any tenderness?
No.
Okay, we're going to do a couple of hearing tests. So the first one we're going to do is the whisper test. So I'm going to have you cover one of your ears. And I'm going to whisper some numbers over here and just repeat whatever I say. Okay?
6, 7, 8.
Okay, now the other ear.
9, 10, 11.
Okay, great. Then I'm going to use the tuning fork. The first one we're going to do is a Weber test. I'm going to activate this tuning fork and place it on top of your head and just tell me if you hear it the same in both ears or one better than the other. Okay?
The same in both ears.
Okay. Then the next test we're going to do is the Renee test. I'm going to activate the tuning fork and place it behind your ear. Tell me when you no longer hear it, and then I'm going to move it to the front, and then we'll do the same thing. Okay?
Okay.
All right. So on the back mastoid bone, tell me when you can no longer hear it.
Okay, I can't hear it anymore.
Okay, then tell me when you can no longer hear it.
Okay, I can't hear it.
Okay, then we're going to do the same thing on the other ear. Tell me when you can no longer hear it.
Okay.
And then when you can no longer hear it.
Okay, I can't hear it.
Okay. So the next thing I'm going to do is I'm going to inspect your eyes. The eyebrows come over the eyes. The eyes are symmetric. I don't see any drainage or discharge. The sclera are clear. The eyelashes are growing outward. There's no redness, no flaking of the eyelids or eyelashes. The pupils are round and equal. And let me have you do this. I'm going to have you look up. The conjunctiva are nice and pink. And look down. Look down. Okay. I'm going to palpate around the eyes. Tell me if this is painful. Does that hurt at all?
No.
Okay. So there's a few eye tests we're going to do. So I'm going to hand you this card. I want you to hold it at reading level. I want you to cover one eye and then read to me the lowest line that you can read.
2, 8, 4, 3.
Okay. So 2200 in that eye. Then cover the other. And same thing. Hold it at reading level and read the smallest line you can read.
6, 3, 8.
Okay. So 2100 in the other. So very good. Then the next thing we're going to do is for peripheral vision. So I want you to cover one eye. I'm going to cover the same eye, and then when you see my fingers come into view, tell me, okay?
Okay.
Okay, so tell me when you see my fingers.
I see him.
Okay,
See him.
okay,
See him.
and tell me when you see them.
I see him.
Okay, now cover the other eye. Okay, same thing. Tell me when you see them.
I see him.
Okay,
See him. See him.
and no.
I see him.
Okay, very good. Okay, so the next one we're going to do is corneal light reflex. I'm just going to shine this on the bridge of your nose, and the light reflects equally in both eyes. Okay, then we're going to do cover uncover test. So I want you to cover one eye, doesn't matter which one, focus on this pen, and then move your hand away. And both pupils constrict. Very good. Now cover the other eye, focus on this pen, and then move your hand away. temples constrict. Very good. The other thing we're going to check is fields of gaze. So I want you to follow this pen light just with your eyes, not with your head. Okay? Okay, then I'm going to check for lid lag. So same thing, follow this pen with your eyes, not with your head. Okay, then I'm going to check for pupil response. So there are two that we're going to do here. I'm going to do direct, and then I'm going to do consensual, okay? So I'm going to start over here. I'm going to shine the light and watch the pupil to constrict. And then I'm going to shine it again and watch the other eye constricts. And it does. So same thing over here. Direct, constriction, and then I'm going to look aside and see that the other eye constricts, and it does. Okay. The last test we're going to do is accommodation. So I want you to focus on an object towards the back. I'm watching that your pupils dilate. And then I want you to focus on this pen. And they constrict. Very good. Okay. So the next thing I'm going to do is the nose. So the nose is symmetric. I'm inspecting. I don't see any rashes or lesions on the outside of the nose. I'm going to have you tilt back a little bit. I'm going to take a look inside. The nasal mucosa is pink. I don't see any obstructions on the inside of the nose. Go ahead and look back down. I'm going to palpate the nose. Any tenderness or pain?
No.
Okay. Then I'm going to inspect the mouth. So for the mouth, the lips are pink in color. They're not cracked. I'm going to have you open up. I'm going to use this pen light and just take a look inside. The mucosa is nice and pink and moist. The gums don't have any swelling or bleeding. The tongue doesn't have any lesions. I would like you to go ahead and stick out your tongue at me. Oop. Stick out your tongue and say ah. Say it again.
Ah.
And the uvula rises. The tonsils are both in place and they're about a grade 2. The other thing I'd like you to do is stick out your tongue, move it from side to side. Very good. And I'm going to inspect the inside of your mouth here. So I'm going to put on a glove so I can take a look at your tongue. It's a gauze. And I'm just going to inspect the back of your tongue to make sure that there is no lesions. Okay, so go ahead and stick out your tongue. I'm going to grab it so I don't see any lesions or sores on the back of the tongue. For the water? No? Okay. Okay. So I did hair, skin, nails, eyes, nose, mouth. Okay. Now we're going to move on to the chest. So I'm going to have you take off your shirt, please. And I'm going to move to the back part of the chest, okay?
Mm-hmm.
This is all I need. Okay. So I'm looking at the back of your chest. The skin is even in color. There are no rashes, there's no lesions, no scarring anywhere, no bruising. I'm also looking at respirations, which are unlabored and even. There's no retractions, no use of accessory muscles. So the first thing I'm going to do on the back is palpate the back of the chest. So tell me here, do you feel any pain or tenderness?
No.
Here?
No.
Okay. I'm also going to do the lateral thorax on both sides. Any pain or tenderness?
No.
Okay. I'm going to place, I'm going to check for tactile fremitus. So I'm going to put my palms on the back of your hand, my palms on your back, and I'd like you to say 99.
99.
Again.
99.
Again.
99.
And again.
99.
And again.
99.
So the vibration was even. I'm also going to check for thoracic expansion. So I'm going to put my hands on your back here. I want you to take a deep breath in. Okay, and out. And the hands expand symmetrically. I'm also going to percuss the chest on the back. Okay. Okay, and I'm going to do the lateral thorax as well. Okay. I'm also going to, while you're sitting up, check for costrovertebral angle tenderness. So I'm going to place my hand on the back here and I'm going to do a fist percussion. Do you feel any pain?
No.
And what about here?
No.
Okay. So now I'm going to take a listen. Just breathe normally in and out through your mouth, please. Okay, and the lateral thorax as well. Okay, I'm going to come back around to the front. Okay, so same thing on the front. I'm inspecting the skin. The skin is even in color. There's no rashes or lesions. I'm inspecting the AP diameter to the lateral diameter, which is less. There's no retractions, no use of accessory muscles. I'm going to palpate the front of the chest, so tell me if you feel any pain. No pain?
No.
No tenderness?
No.
Okay. And I'm going to listen. I didn't hear anything abnormal, but if I did, I would do a couple of additional tests, which would be egophony, bronchophony, and whispered pectoriloquy. Okay, so now I'm going to have you lay down and we'll start with the cardiac exam. Okay. Okay, so with the cardiac exam, there are a few things we're going to be looking for and listening to. First is, there are 5 areas that we listen to the heart. The first is the aortic area at the second intercostal space right sternal border, the pulmonic, which is at the second intercostal space left sternal border, the second pulmonic, third intercostal space left sternal border, the tricuspid, which is at the fourth intercostal space left sternal border, and the mitral, which is at the fifth intercostal space left of the midclavicular line. We're also going to note S1 and S2. S1 is the closure of the mitral and the tricuspid valves, and S2 is the closure of the aortic and pulmonic. And if we heard any systolic murmurs, those would be heard after S1. Diastolic murmurs would be heard after S2. Also, if I heard anything unusual on auscultation, I would have my client sit up or lay on their left side to bring the heart closer to the chest wall. So the first thing I'm doing is just inspecting the precordium. I don't see any lifts or heaves or thrills or any pulsations. I'm going to palpate lightly. I don't feel any heaves, any lifts, any thrills. I'm going to try to palpate for the point of the apical impulse. Just about here. There it is. Okay. And then I'm going to take a listen. So first with the diaphragm. And then I'm going to apply pressure to the stethoscope to the this area to activate the bell. And from the stop. Okay. While I'm here, I'm going to palpate the temporal arteries. Listen. I'm going to palpate the carotid arteries. And listen to both of those. Next I'm going to do the rest of the pulses. I'm going to do the radial pulses. The brachial. I'm going to do behind the knees, the popliteal. Okay, the posttibulars at the soft part of the ankle. Okay, so now I'm going to move on to the abdomen. I'm looking at the abdomen. The abdomen is rounded but symmetric. I don't see any scars, any striae. I don't see any peristalsis. The breathing movement is even and unlabored. Next I'm going to listen. I'm going to listen for bowel sounds in all 4 quadrants. Sounds in all 4 quadrants. The next thing I'm going to do is do a light palpation. Tell me if you feel any pain.
No.
No pain?
No.
Okay, I'm going to do a little bit of a deeper palpation. Tell me if you feel any pain. And I'm going to try to palpate the umbilical area. I don't feel any edema or swelling here. Next I'm going to percuss the abdomen. Okay. And then I'm going to try to palpate the kidneys and the liver. Okay, so I'm going to bring my hand up underneath your back. I'm going to press in and take a deep breath in and out. Okay. Same thing on the other side. And under the small of your back, I'm going to press in. Deep breath in and out. Okay. Okay, and then I'm going to try to palpate the liver. So I'm going to come from behind and place my fingers right up underneath your ribs. And I'd like you to take a deep breath in and out. One more time. Okay, very good. Okay, so now, while you're laying down, I'm going to start some musculoskeletal examinations. So the first thing that I want you to do is to bring this knee out to the side and back. Out, nope, this way. This way out. Out and back. Same thing with this leg. Out and back. Okay, now I want you to bend it up to your chest, knee to chest, and back. Knee to chest with the other leg, and back. Okay. Then I want you to try to lift your leg against my hands. Okay. Same thing with the other leg. Okay. And I'm going to go ahead and have you sit up to finish the rest of the exam. And have you scooch back down here. Okay, so we're going to continue with the musculoskeletal system. I want you to please bring your chin to your chest, back, lateral, so one ear to this shoulder and then to the other. Okay, and then I want you to push against my hand and then push against my hand. Okay, for your shoulders, I want you to do like this, up and over, and then cross in the front. Cross all the way in the front. Okay, then hold your arms out like so. Oops. Then reach behind your back. Touch in the small of your back. And then touch behind your head. Okay, now bring your shoulders out, and then pull up against my hand, and then push against my hands. Okay, now we're going to do the elbows. So bend your arms like so, and then back out. Okay, then do your hands this way and that way. Okay, bend your elbows up like this, push against my hands, and pull. Okay, go ahead and relax. Let's do the wrist. Wrist like so, and then down, and pull against my hand, and do them up like so, and push against my hand. Okay, fingers. Do your hands like this, and then close, and then grip both of my hands. Okay, do that. Straighten this knee straight out, and back down, and now this leg, out, and back down. Okay, push against my hands, and pull. Okay, with your feet, point your toes straight down, and point them back up. Okay, relax. Then push against my hands, and then down. Okay, bring your soles together, like so, like you're folding them up, there you go, and then back out. Okay, very good. While you're sitting, I'm going to check for balance. I'm going to give you a little nudge. Okay, you're able to keep your balance. I'm going to do some of the neuro exam while you're sitting up. So the first thing I'm going to do is, I'm going to do your deep tendon reflexes. So I'm going to hold on to your arm inside of mine, leave it real loose, and look away for me, please. Your arm like so, leave it real nice and loose, look away. Okay, look away. Okay, and then we're going to do the next one. I'm going to hold your thumb up, leave it kind of loose and hanging, let it go, look away. Okay, then the other arm, same thing. Hold on to your arm, leave it loose, 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 look away. Okay, same thing, let it hang loose, 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 don't look. And, okay, last time, leave it hang loose, 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 look away. We're going to go down to your knees. I'm going to check these here. So look away. Then I'm going to come down and check the Achilles. Loosen your leg. Let it hang loose. Do the Babinski while I'm here. Watch the toes curl in. Okay, I'm going to come over here and do the Achilles on this foot, nice and loose. And then the Babinski on this foot. There you go. It curls in. Okay. So the next thing I'm going to do is some neuro. So this is the cotton. It's going to feel like this. I want you to close your eyes and tell me when you feel it when I brush on different parts of the arms and legs, okay?
feel it. I feel it. I feel it. 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 Yep. Yep. Feel it. Feel it.
Okay. The next thing I'm going to do is sharp and dull for pain sensation. So I have a tongue blade that I broke in half. This is going to be sharp. This is going to be dull. Okay? So close your eyes and you just tell me if it's sharp or if it's dull. Okay?
Dull. 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 Sharp. Sharp. Dull. 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 Sharp. Sharp. Dull. Sharp. Sharp. Dull. Dull.
Okay. The next thing I'm going to do is the joints. So I'm going to show you what we're going to do. This is up, this is down, and this is neutral. Okay? So close your eyes and tell me if it's up, down, or neutral.
Up. Down. Neutral.
Okay.
Up. Down. Neutral.
Okay, I'm going to do the toes too.
Up. Down. Up. Down. Neutral.
Okay. Okay. The next thing I'm going to do is check for vibration in the joints. So I'm going to activate this tuning fork and you tell me when you feel the vibration on your joints, okay?
Okay. Feel it. I feel it. I feel it. Feel it. Feel it.
Okay, down your feet.
Feel it. Feel it. Feel it. Feel it.
Okay. The next thing I'm going to do while I'm here is I'm going to have you close your eyes. I'm going to write a number on the inside of your palm and you tell me what number I write. Okay, close your eyes. And what number am I writing?
7.
Okay, and the other hand. And tell me what number.
3.
Okay. Then I'm going to put two objects, a different object in each of your hands. I want you to close your eyes and when I put the object in your hand, you tell me what it is. Okay? So close your eyes. See the first hand. Close.
It's like a penny.
It's a coin. Yep. And then the next hand. Opposite hand. And close. And what is this?
It's a bobby pin.
It is. Okay. Okay. So I did that. Okay. So for the next part of the exam, I'm going to have you stand up. I'm going to have you face this way and put one arm on the table so I can see your legs. And then extend one leg back. Nope, not while you're standing, just lift it back like this. Like straight out back. There you go. And then the other leg. Okay, then turn around and face me. I want you to stand with your feet together, eyes closed. So slight swing, but no loss of balance. Very good. I'm going to give you a little walking test. You might have to move over a tiny bit to get right here. So come right here. First, I'm going to have you bend forward. You don't have to touch your toes, but you have to bend forward. Okay, then lean back. Okay, lean to the side, lateral, and the other side. And then do a twist. So, okay. Then I'm going to have you face this way towards the window. And I'm going to have you walk to the seating area. So walk normal gait. Okay, then turn around. When you come back, I want you to walk heel to toe. So toes, heel, yep, all the way back. Very good. Now when you walk back, I want you to walk on your heels. And then walk back on your toes. Very good. Okay, so I'm going to have you take a seat. I'm done with the exam, I'm just gonna review my notes and make sure that I didn't miss any portions of the exam, okay?
Okay.
Only have a couple minutes, let me look at these real quick and I'll almost be done. I did these, let me just take a look real quick. Okay. Did this. Okay. Oh, I forgot coordination. That's what I forgot. Okay, hold your hands out like this. Touch your hands, finger to your nose. And then do the other hand back and forth and then do it fast. With your eyes closed. Okay. Now look at me. With one hand, I'm gonna have you touch your nose and then touch my finger. Okay, so touch your nose, touch my finger. Touch your nose, my finger. Touch your nose, my finger. Then the other hand, your nose, my finger, your nose, my finger, your nose, my finger. Okay, now on your lap, put your hands flat and then flop back and forth. Very good. Thank you very much for your help.
You're welcome.